Today's top stories. Postpartum health coaching boosts blood pressure control. Women taking estrogen had fewer signs of Alzheimer. S in their brains. COVID-19 awakens dormant viruses. And one is linked to long COVID. A little movement in midlife could pay off for your brain years later. The common mistake that could make aging joints hurt more. Scientists reveal why walking gets so much harder with age. Metabolic, autoimmune links seen in sclerosing mesenteritis. This is what mRNA vaccines may actually do in the body. Hospitals say wristbands may help reduce childbirth risks, and Photon-Counting CT boosts stent fracture detection. We start with postpartum health coaching boosts blood pressure control. Postpartum health coaching boosts blood pressure control. Health coaching after labor and delivery significantly improves blood pressure control for women with a hypertensive disorder during pregnancy, HDP, while doubling the likelihood of attending follow-up visits with a primary care clinician, according to a randomized clinical trial published in JAMA Network Open. The disorders, including gestational hypertension and preeclampsia, are a leading cause of pregnancy-related death and are associated with the development of heart failure, cerebrovascular disease, chronic hypertension, and cardiovascular disease. Roughly 15% of pregnant women have an HDP. Yet many patients disengage from medical care after delivery. Coaching did not focus specifically on reducing blood pressure, but on the patient's health goals, said Megan Knutson-Senays, MS, exercise physiologist at the University of Wisconsin-Madison Prevention Research Center, who led the study. It's scary, traumatic, and surprising to be diagnosed with a hypertensive disorder of pregnancy, Senays said. So a lot of these people really did care about their blood pressure, and I really had to let them lead the conversation and ask for permission to share evidence-based GUID. Women taking estrogen had fewer signs of Alzheimer, S in their brains. Women taking estrogen had fewer signs of Alzheimer's in their brains. Date: August 14, 2026. Source: American Academy of Neurology Summary. Women who used estrogen-only hormone therapy later in life were less likely to develop dementia and showed fewer signs of Alzheimer's disease in their brains, according to a large study of more than 21,000 participants. Hormone therapy use was linked to 39% lower odds of a dementia diagnosis and 35% lower odds of Alzheimer's-related brain changes at autopsy, including amyloid plaques and tau tangles. Biomarker tests also suggested less amyloid buildup among hormone therapy users. Share. A large study has found that women who used hormone therapy later in life had a lower risk of developing dementia. The findings were published August 12, 2026, in Neurology, the medical journal of the American Academy of Neurology. Researchers emphasize that the results show an association and do not demonstrate that hormone therapy can prevent dementia. While these findings help us better understand the relationship between hormone therapy use and various markers of dementia, more research needs to be done before we can make recommendations to WOM. COVID-19 awakens dormant viruses, and one is linked to long COVID. COVID-19 awakens dormant viruses a circumflex, and one is linked to long COVID. COVID-19 may awaken hidden viruses inside the body, and one mysterious viral family could hold new clues to long COVID. Date: August 15, 2026. Source: Boston Children's Hospital Summary. COVID-19 can reactivate dormant viruses hiding in the body, including Epstein-Barr, cytomegalovirus, and several herpes viruses. One poorly understood viral family was strongly associated with long COVID and lasting disability, offering a potentially important clue to why some patients struggle to recover. Share. Viruses that remain in the body for years, including Epstein-Barr, cytomegalovirus, CMV, and herpes virus, are extremely common. In many people, they cause no symptoms and appear to be harmless. But growing evidence suggests that when these dormant viruses become active again, they may play a role in autoimmune diseases and other long-lasting health conditions. Now, researchers at Boston Children's Hospital and collaborating institutions have found that COVID-19 can reactivate certain dormant viruses in hospitalized patients. The findings come from a new Nature study involving 15 biomedical research institutio. A little movement in midlife could pay off for your brain years later. A little movement in midlife could pay off for your brain years later. Staying active and controlling blood sugar in midlife could help keep the brain sharper for years to come. Date: August 16, 2026. Source: the University of Texas at San Antonio Health Science Center. Summary: exercise and healthy blood sugar levels in midlife may help slow cognitive decline decades later. Physical activity appeared especially beneficial for Mexican-American adults, suggesting that some brain protective factors may differ across populations. Share: physical activity and healthy blood sugar levels during midlife may be linked to a significantly slower decline in thinking abilities later in life, according to new research from UT Health San Antonio, the academic health center of the University of Texas at San Antonio. The findings suggest that exercise may be especially important for Hispanic adults. Scientists already know that cardiovascular problems in midlife can raise the risk of cognitive decline and dementia. This study is among the first to investigate how specific cardiovascular health factors may relate to cognitive aging across different ethnic groups. Researchers analyzed 402. The common mistake that could make aging joints hurt more. The common mistake that could make aging joints hurt more. Date: August 16, 2026. Source: the Conversation Summary. Aging gradually wears down the cartilage and fluid that protect our joints, but avoiding movement may actually make matters worse. Exercise helps nourish cartilage, strengthens the muscles that protect joints, and can reduce osteoarthritis pain. Low-impact activities such as swimming, cycling, tai chi, yoga, and walking on varied terrain may also improve balance and mobility. Even a few minutes of the right kind of movement can make a difference. Share: growing older has plenty of upsides, but achy joints is not one of them. As we age, the joints that once handled every bend and fall start to weaken. This is because the amount of cartilage, a tough but flexible kind of connective tissue, and fluid in your joints decreases over time. This may lead some people to avoid activities such as exercise, but with the right approach, exercise can actually help protect your joints. Let's dive into the science. Why joints matter. Each joint is cushioned by articular cartilage, a type of specialized tissue that covers the ends of bones. This cartilage protects the joint. Scientists reveal why walking gets so much harder with age. Scientists reveal why walking gets so much harder with age. Date: August 16, 2026. Source: Flinders University. Summary: as we age, the body appears to sacrifice walking efficiency in exchange for stability. Older adults stiffen the ankle more with each step, which may help prevent falls but also forces the muscles to work harder while producing less forward motion. This leads to shorter strides, slower walking, and faster fatigue. Exercises targeting balance, coordination, and lower leg strength could help preserve mobility. Share: new Australian research is shedding light on why walking often becomes slower and more tiring with age. The findings suggest that the body gradually gives up some movement efficiency in favor of staying stable and upright. Led by researchers at Flinders University and the University of Canberra, the study found that aging is associated with a safety-first walking strategy. This approach emphasizes stability instead of speed and energy efficiency, helping explain why older adults may fatigue more quickly and also face a greater risk of falling. Researchers analyzed movement data from 107 healthy adults between the ages of 26 and 86. They foo. Metabolic autoimmune links seen in sclerosing mesenteritis. TOPLINE patients with symptomatic sclerosing mesenteritis, SM, presented with abdominal pain and had conditions such as immunoglobulin G4, IgG4, related disease, abdominal and/or pelvic malignancies, or metabolic syndrome. Methodology: researchers conducted a prospective cohort study to evaluate the clinical features, outcomes, and therapeutic management of patients with symptomatic SM over 11-year follow-up. They included 55 patients with symptomatic SM, mean age at diagnosis, 62 years, 56.4% women, who presented at 2 tertiary medical centers in Greece from January 2014 to 2025. Symptomatic SM was classified as mild, moderate, or severe on the basis of symptoms and imaging findings, ranging from a localized mesenteric fat mass to a complicated course requiring hospitalization and/or surgery. All patients underwent annual clinical examinations, CT or MRI, and laboratory tests throughout the follow-up period. Treatment selection depended on the severity of the disease, clinical features, and radiologic signs, and treatment response was assessed after at least 12 months of continuous treatment. Patients were divided into 3 groups: responsive, non-progressive, and progger. This is what mRNA vaccines may actually do in the body. Recent mouse studies suggest mRNA vaccines work by enlisting muscle and other cells, not just the immune system's usual entry points. That shift in understanding could reshape patient counseling and how cancer vaccines and gene therapies are designed. 1. Challenged assumptions. For years, researchers assumed mRNA had to reach dendritic cells directly to trigger immunity. However, new data from a study published in Nature Biotechnology mouse suggest nearby non-immune cells can produce antigen and hand it off to dendritic cells instead. 2. Muscle and liver. In mice, blocking mRNA expression in muscle cells lowered T-cell responses, while blocking it in the liver tripled them, pointing to a breaking role for liver cells. Silencing dendritic cells spared T-cell activation but cut killer T-cell numbers in half, except when the antigen was spike. 3. Multiple handoffs. Conventional vaccines depend on dendritic cells capturing and presenting protein. mRNA vaccines appear to add 2 more routes: cross-presentation, where free antigen is picked up by nearby dendritic cells, and cross-dressing, where a preloaded MHC molecule is transferred directly. A study published in Nature noted the nature by. Hospitals say wristbands may help reduce childbirth risks. Hospitals across the U.S. are trying to reduce maternal deaths and complications after pregnancies using one small tool: a silicone wristband stamped with the declaration, "I gave birth." The wristbands are part of a growing initiative first launched by North Carolina-based ECU Health, as Congress sought to address the nation's growing maternal mortality crisis during the COVID pandemic. Since 2021, nearly 50 North Carolina hospitals and the state's health department have begun distributing the wristbands to give mothers and care providers a visual reminder of the life-threatening health risks after birth. The Connecticut State Health Department, large health systems in Arkansas, Georgia, and Mississippi, and hospitals in at least 24 other states have also embraced the program. The wristbands are intended to make emergency workers aware of postpartum risks, ensure better treatment, and help lower maternal mortality rates in the U.S., where nearly 70% of pregnancy-related deaths happen after the day of delivery, and nearly 40% happen after the 6-week mark. This year, North Carolina plans to expand the initiative with part of the $213 million it received through the Rural Health Transform. Photon-Counting CT boosts stent fracture detection. TOPLINE Photon-Counting Detector CT, PCDCT, with a sharp kernel and large matrix size, significantly improved the detection of visceral endovascular stent fractures compared with conventional energy integrating detector CT, EDCT, achieving up to 96% accuracy and identifying more than 80% of otherwise undetectable type 1 and 2 fractures, a phantom study showed. Methodology: researchers placed 5 identical 7-balloon expandable covered stents in an abdominal phantom and sequentially created 4 fracture types, ranging from single strut fractures to complete transverse linear fracture with stent displacement. Stents were scanned using a PCDCT system and a conventional EDCT system under clinical acquisition protocols. PCDCT images were reconstructed at ultra-high resolution, UHR, a slice thickness of 0.2 and a matrix size of 1024, and standard resolution, SR, a slice thickness of 0.4 and matrix sizes of 512 and 1024, using medium sharp and sharp kernels. 2 independent radiologists with 5 and 7 years of experience in vascular imaging assessed diagnostic accuracy and image quality in a blinded, randomized manner. Outcome measures included overall diagnostic AC. That's all for this news briefing. Thanks for listening. Also, don't forget to hit the subscribe button.